All right, I'm back in plenary session, virtual edition, and I'm joined by two wonderful people. I'm joined by Robert Hughes. Robert Hughes is a medical doctor by training, but he has expertise in global health, and he's currently a research fellow in the United Kingdom in London. And I'm joined by Mark Tomlinson, who is an expert in childhood development and also does work in global health, and he's joining us from South Africa. Gentlemen, it's a pleasure to have you both here today.
That's great to be here.
So where to begin? Where to begin? I'm here based in the United States, and I read some things here and there that strike me as a bit odd. They strike me as the kind of claim that is a troublesome claim. Now, I think we will all agree, all three of us, that we ought to do anything within our power to minimize the harm of SARS-CoV-2, particularly for younger people. But we also have to remember that young people have diverse needs, and SARS-CoV-2 is one challenge they face. But growing up into healthy and strong people is another challenge they face, and we have to balance these competing interests. And in different countries around the world, we've done different things. But in the United States, in a lot of places, actually has less to do with SARS-CoV-2 and more to do with political valence. We have closed schools for over a year. We have kids in schools based on recommendation from our CDC and our American Academy of Pediatrics. They're wearing cloth masks from the ages of 2 through 6, which is against the WHO, but it's what our expert bodies recommend. And we have babies in daycare, often the children of essential healthcare workers who are in daycare all day, every day, and the healthcare provider has a mask on. And I think what caught all of our eye and what you all have been writing about is that there is an importance, I think. There's a downside to some of these policies. I wonder, maybe we'll start with you, Rob, if you might talk a little bit about how you think about these issues.
Yeah, I mean, look, it's not a novel thing in public health to be saying what's the benefits and what's the harms to any intervention. I mean, absolutely any intervention. Now, obviously, some interventions are extremely low risk, very cheap, and those harms are limited to just what else might you spend the money on. But when it comes to the control of COVID, I think initially there was a real kind of throw everything at it. And I think that made sense in many senses early on. Novel virus, everyone was unclear, really concerned. But actually that's not that's a time-limited approach. We've got to start using our our public health brains and saying, what are the pros and what are the cons of different interventions? And also how are different groups affected? And I guess the thing that really kind of triggered me and Mark and our colleague Sunil to writing this was seeing the work that American Academy of Pediatrics were putting out, or I say work, I mean the statements they're putting out.
Yeah, statements.
Around early childhood and early childhood development. And I guess my first reaction was, have they ever met a 2-year-old recently? And that's from 2 points of view. I think this idea of kind of universal masking in childcare, look, this is not a short-term thing. It's often long hours. It's can be morning to night. And also, 2 or 3-year-olds' compliance with wearing a mask, their actual practice, it just doesn't make sense for us to extrapolate from the much more limited data around surgical mask wearing in hospitals, for example, through to children wearing masks. And then the second part of that, have they seen a 2-year-old recently, is that kind of joy and the pleasure and the excitement of interacting with a toddler. The sort of sparks of like making faces to each other and the smiles. And I guess that struck me of like, well, look, maybe there's a justification for this. And I thought, well, I'd love to read this. And I sat down and I got the CDC guidance out and I watched everything I could see that Anthony Fauci was putting out, that the American Academy of Pediatrics were putting out. And it seemed to be very thin.
Yes.
And then I spoke to some virologist colleagues and people who are really much more expert than me on the transmission. And it just looked more and more to me that the case for masking was incredibly thin. And the potential harms, I think, are quite significant. So we wanted to write something and we put it down in this preprint, which is under review at the moment. And very genuinely have put this out on social media to say, look, are we missing something here? There ought to be a justification for this. And then the more I've looked at, there's a fairly recent study from the Catalan group, Alonso in Spain, which really it was a very nice actual experiment of not masking
Yes.
under sixes, where
Regression
they
discontinuity. Yes, you see the
well,
right.
exactly.
Yes, yes.
It essentially showed that age-related transmission risk was in bubbles, and there was nothing to suggest that the masking had an additional
So
benefit.
let me just explain that to
And
listeners. So basically, what Rob is pointing out is that in Catalan, in Spain, they masked above 6, but not below 6. And if you
mm,
believe that the masking is conferring a significant benefit, you would expect there's a certain rate of SARS-CoV-2 at every age. But when you get from that no mask to mask group, there's a big kind of step in the curve. The step
mm,
tells you the benefit of masking. But what you see is it's a slow, age-dependent relationship. As you get older, there's a higher risk than younger. And there's nothing that happens between 5 and 6 that doesn't happen between 6 and 7 or 4 and 5. And you can't tell when the masks were implemented, which might tell you that at best the effect size is very, very small.
exactly. And I guess that, you know, essentially the point, I think the onus is really on those pushing
Yes,
for
I
this
think so.
policy of universal masking for younger kids to say, well, look, tell us your justification, and engage with this question around the harms.
Yes.
Because I do think it's not, I don't think it's like hyperbole to say that there's a generation of kids in childcare whose early child development is, you know, doing that to kids would have been unthinkable.
Yes.
You
Right.
know, you'd never do a study on it, so there is no data on it. But we know that nonverbal communication is important. We know that interaction between caregiver and child is really powerful. I mean, Mark's done incredible work on
Yeah,
this,
let's talk about that.
and describes it much better than me actually. But you know, that sort of spark, the back and forth interaction, the serve and return, that as the Harvard Center call it.
Mark, what are your thoughts on this issue? You've written eloquently about it, and you've been in this space for some time now, doing work on childhood life development.
Thanks. I mean, I suppose my point, and I, you know, as you guys can imagine, we wrote the piece together. I agree with everything that Rob said, and it's just trying to open up a debate for a little bit more of a sort of an approach that's more subtle and not a kind of a one-size-fits-all approach. You know, everybody masks no matter what, and because one of the consequences of that, and as Rob pointed out quite eloquently, you know, that was probably appropriate before we had vaccines, right at the beginning of the pandemic. Things have changed, and we have to change with that. One of the big consequences of that one-size-fits-all approach is we have forgotten about children and adolescents.
Yes.
That balancing every decision based on their short-term, medium-term, and long-term kind of benefit has not really, I would suggest, been part of any of the debates. We are not at all suggesting that adolescents, university students shouldn't be masking. We're saying, let's start a process of some nuance here. You know, should 2-year-olds be wandering around in masks when we know that in those very early years, this sort of attunement between caregivers and children, between child, you know, care officials, people working in preschools and children, between peers and between two-year-olds wandering around, watching the other, watching what their face does, watching their responses, watching when, you know, that's how they're starting to learn the early origins of, like, well, if I do that and the response is that smile, well, that suggests that I did something they like. Whereas if I do some, you know, and, you know, Alison Gopnik and colleagues have written they wrote a wonderful book many years ago called Infants as Little Scientists. And they talk about toddler years as well. And they talk about a story of, like, a parent being irate about how their toddler, you know, you walk into a room and you see the toddler look at you and then pull the lamp off to break it. And you're like, well, what was going on? And what they're doing is they're learning cause and effect. You do that, I do this, and you get cross. But if I did it in a different way, and they're literally experimenting on the world. And by forcing a 2-year-old to wear a mask, we're removing literally that experimentation, we would suggest. And if we could be shown the evidence to show that the benefits of that masking far outweighs the risks of the things we're talking about, we would be the first to suggest it. But we're not seeing that.
I'll just say that's really well put. And, you know, one of the pieces of data that was marshaled, I saw online, was something that, you know, when you study the eye tracking of an infant or a young child, when they're watching you talk, they spend twice as much time looking at your eyes as at your mouth. And I think the implication was that the eyes are twice as important. But the other way to interpret that is the mouth is so expressive that with half as much time, you get that part. Now let me try to figure out the eyes part. And to think that, I mean, the human face has evolved to show you so much intent, meaning, purpose. Somebody else argued back that said that, blind children do just fine in this world without having ever seen a face. And I thought to myself, blind children and blind people have wonderful lives, and they are capable of tremendous accomplishments. But the one thing that they don't have is they cannot see someone's face at 50 yards away and know the intent of that person as they're approaching them. And that's just the nature of it. And so one cannot extrapolate what sighted children need from the experiences of blind children, or vice versa. I thought that was a non-coherent argument. And I think the point that troubled me is the point that Rob and you both are making, which I feel quite bad about, which is the American Academy of Pediatrics. It's in their name. They have to stand for children, and the CDC has to stand for, I guess, the health of the populace. But the American Academy of Pediatrics, and for them to write these things so flippantly, to discount the potential for harm so prima facie, without ever having shown that the intervention actually has a benefit in this age group, which we can talk about in a second, to me, that is so hurtful. I wonder, and I tweeted this, who is looking out for kids in this country? At least thank God you have the WHO, you have UNICEF. But who do we have looking out for children? We have abdication from the pediatrics organization. We have so many pediatricians saying, I had a baby in my office and the baby looked just as happy not seeing my face. That little anecdote they toss out there. This is, I think we're deluding ourselves into thinking that this is a consequence-free intervention. And that to me is really heartbreaking to see that.
No, I think you're right, and I think this has been a global issue. Actually, I think that we children don't have enough lobbyists or enough advocates, and yeah, it's incredibly disappointing when those who are supposedly there, take on the role. I know they're a professional association and they're really for their members, but they also take on a role of speaking for children, or at least they report to, and to just the way they sort of dismiss the concerns around child development, I found very really disappointing. I think at least there's a conversation to be had here, and there's an important conversation to be had here where if quite frankly, I think the minimum they should be doing is saying, let's get together the best experts we can find in the epidemiology and the transmission and the virology, and all of the different kind of parts of the COVID control challenge, and let's also get the experts in child development together, and let's discuss and come to a consensus statement. Maybe they've done that, but they've put nothing out about that.
No.
Maybe they've sat and weighed up the studies, but they've not put out those data. And I feel like there's something deeper here, which is a lack of advocates for children, but also the power of kind of a fear and single issue focus. It's not it's not minimizing COVID to say, well, look, COVID's a part of a bigger ecology of disease and ecology of well-being that we all live in. Actually, I think it's also, another point we haven't mentioned is that it's actually counterproductive to try and draw on kind of credentials and authority for interventions. Like we know that in public health. One of the things that the sort of lines that's been repeated quite a lot around the world about COVID control is that, when the police are calling in the public health department, it's a good thing. When it's the other way around, and the public health department are calling the police, it's a problem. In a similar way, I think when you've got interventions being pushed because we say they should be done, you lose confidence and you lose the buy-in for other interventions. There's a real risk of throwing the baby out with the bathwater here, actually there was a study out today that looked at masking in Bangladesh and suggested surgical masks may have some effect. I haven't actually read it, it's only out today, but I think it's quite reasonable that you'll have a cohort of people who say, look, they've put out this information on masking kids that those of us on the call have been skeptical about, and then they'll dismiss the idea of suggesting surgical masks for older people because they'll say, well, look, if the evidence comes
if some of your recommendations are make-believe and some are good, they can't tell them apart. Vaccinating adults, brilliant idea. Masking 2-year-olds, question mark. But if you're saying both things are hashtag, follow the science, what are we to think? And the lay public naturally would say, I think people have some certain intuition about whether or not a baby needs to see a face, a human intuition. And if you tell them that intuition is delusional, then don't be surprised they never trust you again. Mark, any thoughts on this?
No, totally. I wanted to pick up on one of the important things I think that Rob was saying. I was part of a Lancet commission called the Future Child, which is really making an attempt, given kind of current threats to to children. And, that was actually came out just in February last year at the start of the the pandemic, and making a strong call for putting children and adolescents actually at the heart of all our decisions, because whether it's harmful marketing, whether it's climate breakdown that's happening as well, we have to do better at that. And I worry, as Rob was saying, is when you make a statement about and you're the Academy of Pediatricians, and you make a statement that doesn't have data supporting it, people then wonder why you did that. I mean, my immediate thought is, I wonder if they worry that if you say the 2-year-old shouldn't be masking, that somehow you'll be lumped into the people, protesting, saying nobody should mask. That's our freedom and that, or whatever. And you know what? That's just cowardly. Actually, if we don't have data, at least have a discussion, get people together, as Rob said, get experts together to try and justify it, because otherwise don't tell some truths and not other truths, because then people won't believe anything if they're already skeptical.
And maybe just to add on that, Mark, I think it's also interesting the point that, look, WHO has taken a very clear line on this. They've said no one under 6 should be wearing a mask.
Correct.
And I think if you're going to contradict the World Health Organization,
that's right,
you really need to have a I mean, that shouldn't be a controversial thing to say, but
I know. And then I also said that, you pushed hard on this, and I think I am actually closer to you, but I think that there's some argument to be made. I said, some people say, oh, there's no equipoise. I said, yeah, you're right. There's no equipoise. You shouldn't do it. No, like, there's no equipoise. You can't not do it. I was like, oh my God, that's how you view this? I was like, oh my God, WHO says not to do it. There's at least equipoise, but certainly if the direction of the bias is to not, I would say to not do it. Let me show you the results of this. This is, I think, out just now. You can see it. Bangladesh randomized control trial encouraging adults to wear surgical masks. This is the main finding. I'm just going to show it to people who might be interested. This was the risk of symptomatic seroprevalence in the cloth mask cluster group and in the surgical mask group. This is not significant, p-value 0.54. And this is significant, surgical mask. So what's my point here? So this is a randomized control trial, cluster design. Adults have to be wearing masks. It had a maybe 20, 30 percentage point increase in mask usage by doing this. It didn't have an 80% point increase, but that's life. People don't always do what you say. And it showed the surgical mask group, when adults wore it, they had a lower rate of SARS-CoV-2 spread among older adults in that community, not among the 40-year-olds and less, but, older adults in the community. But the cloth mask is stone cold negative. And I think that it's a problem for the people who have proposed the child cloth mask mandate. One, I think the reality in the United States, we have never had a surgical mask mandate. Not in a single neighbor district. I've never seen it. We've only had cloth mask mandates. I think this study suggests we have been recommending the wrong mask for a lot of people. The second thing, I think it has no applicability to children in grade school. I think it's just didn't look at that population. They behave differently. I think people are going to use this as a justification to push back on some of the things you've said. And I don't think it does that. I know you haven't had a chance to read it. It's 81 pages. I haven't had a chance to read it fully yet. It's only been an hour, I think, since it came out. But wondering what your thoughts are, Rob.
I mean, I had a quick look at it. I had a very quick skim of it, and I guess I think it's certainly curious, the findings around the age distribution. I think I'm trying to get my head around exactly why there's a suggestion that the surgical masks work in the older group. I want to look at that, but it's certainly, as you say, the way I would interpret that is like, sorry, go on.
The way I would interpret that is like, if you ask a community of adults to wear the mask, it's the older people who you see that benefit in. And that could be because they're the ones doing it, or it could also be because they're the ones who are at higher risk of SARS-CoV-2. So it's going to show up there, right? Either one, but yeah.
Yeah. And it was an interesting intervention. I think it was distribution of free masks, plus quite a lot of kind of promotion of mask use and reminders that was needed to sustain. I think there was some washout of effect. But no, I mean, I think it's certainly the absence of effect for cloth masks does raise the question. But, coming back to that first point I said, have you ever met a 3-year-old?
I know.
2-year-old? Studies around mask use amongst surgeons who are operating with very strict infection control protocols, and someone to remind them if anyone's accidentally touched their mask, are very different to a childcare setting where a mask is just another toy. And I do, it's hard to not laugh about it. I mean, I do think the idea that there's going to be kind of effective wearing of masks amongst 2 or 3-year-olds feels like
I gotta say one thing on this. we didn't even mention like the elephant in the room, which is the policy isn't just that they wear the cloth mask when during the day. They have this 2-hour nap in their class. And in the nap, they put them all like side by side in beds. I think they make them sleep head to toe, like that COVID can't go to your toe when you're 2 feet tall. I don't know what they're thinking, but they sleep for 2 hours, no mask. It's a suffocation risk. I think everyone, thank God, agrees on that. God forbid the AAP says no one's ever proven people suffocating on masks, but they don't do it then. But then what is it to do? What is it doing? It's working for 6 hours and the virus is sleeping for 2 hours. I don't even understand the plausibility of how it's working. Mark, I'll let you I know you have to run at 8:30.
And I also laugh. I mean, some of it is just theatre, and whether it was hygiene theatre, our schools here are still I've got 2 adolescent sons. They go to school, there's a case, and they tell the parents, okay, so we're going to do a deep clean of the classroom. And I say to them, I don't like, but can you tell me about ventilation? Just mention ventilation, please, once, just somewhere along, you know me. But somehow we're all reassured if there's lots of people running around cleaning things, And I don't know. I knew a couple of months ago there wasn't a single case. Maybe now that's been, absolutely proven to have been transmitted on but it's so much is theatre and I think, but I mean that's the one where the funny that's almost mocking, but the reality is that also people are scared, and there's a level of containing our fears, which I think is important. And we haven't been good at finding ways to contain people's fears, to give them to show actually, I think science can actually be very reassuring and containing, even the fact that there's lots we don't know. We don't know everything in science. We're working it out, but like stuff's coming out all the time, and that's good, and we're learning more, and we have these vaccines, but we're not communicating that very well because we're now worrying about hygiene theatre. Yeah,
right. Rob, I wonder if you might just tell listeners, I don't think they're even aware, the masking policy in the United Kingdom. You've never mandated masks under 12. You don't mandate that babies the caregivers of babies in infant daycare wear masks. In fact, they do not. They wear masks when I think they do the handoff, but then they don't inside. I wonder if you might talk about, the kind of heretic stuff you're doing in the UK.
Yeah, I mean, look, it's worth saying it's not entirely without controversy. So some people will feel that we have removed the requirements for masking in secondary school too early, for example. I think it's fair to say that I think secondary schools still have they are still allowed to introduce masking, and if there's particularly high prevalence in their school, then they will. I think it's a bit more. It tends to be a bit more nuanced. So people will say, look, in congregating communal areas, for example, in crowded corridors, then wear a mask, would be the general sort of gist of it. Primary school kids, my kids are both in primary school, so I don't know how to translate into American years, but they're 6 and 8 year olds.
Okay.
They in their school, they've never had masks. The teachers were briefly wearing face coverings when we had our kind of Delta wave in particular, concern. And and actually now there's no formal mask mandate anywhere except on public transport, I think, and it slightly depends around the country. And the practice is drifting. I mean, I was on the London Underground yesterday, and probably 10 to 20% of people were wearing masks. So it's. I mean, I think one of the things I slightly flippantly said is that I think that wearing masks is a bit like the cycling helmets debate in like active travel, in that I suspect, talking about cycling helmets, if you talk to a Dutch person, they'll tell you, I'd much rather have a bike lane and a kind of culture of active travel and bikes not being secondary citizens on the road. In the same way, I suspect my feeling is that masks are a big distraction from us thinking about, look, okay, is there any school left that has a window that can't open, or a sufficient ventilation system? Things like that make a lot more sense to me than us getting it's a fixation error. I mean, we talk about the stuff in clinical medicine. We talk about the planes that drive into the mountainside because the pilot's fixated on the flashing button on the dash. There is a risk of this becoming a fixation error for some groups, that it's a visible thing. And I'm not an anti-mask person. There's this real fear. Mark said that if you come out and you say, look, I don't think a 3-year-old should be forced to wear a mask 8 hours a day, that you're going to be labeled as someone who's going around like lighting flares in Trafalgar Square and marching and talking about the Magna Carta. I mean, there is it can get a bit uncomfortable actually questioning authority in this situation in the middle of a pandemic. But I guess how long's that period for?
Yeah, so I mean, those are some really good points, which is that the point that you made earlier on, which is that everyone gets 3 months, 6 months where you can do what you want before you get data, but at 18 months you got to show me some data. I mean, I that's gone on too long. And then your other point is well taken, which is that I'll believe the Bangladesh trial when I read it completely. I'm going to believe it because I believe in cluster randomization. That's the answer to some of these questions. You want an answer, you get the answer. But if cloth masks don't work and surgical masks do work, would have been nice to know that a year ago rather than wear the wrong mask. I've been wearing the wrong mask too, and I don't feel good about that. So I think one of the challenges here is, I hope we're better than the people who survived the plagues of Europe in the Middle Ages. I hope we're better in the sense that, like, yes, when things are bad and you are scared, you can do things, but let's not slaughter the goat. Let's not get the 2-year-old to wear the mask. Let's get ventilation. Let's give vaccines. Let's do the things that work. Why do we have to be ignorant? Why do we have to do things that don't work? Can we be better than our ancestors? And hopefully 500 years from now, they'll be a little bit better than us. Mark, I know you have to run in a minute. So any final thoughts on this issue?
So my most cynical, despairing moments, I'm not sure. We probably will do better, but I sometimes do. I do worry a little. But then I've seen just in my little anecdotal, lived experience here in South Africa, watching people around me. My research group who were 3 months ago on the border of being anti-vaxxers, and 3 months later have got vaccinated. I've seen massive shifts of people. We're watching people around them have the vaccine, not get sick, seeing other people get sick and die, and so I've seen, stuff that does make me hopeful as well, and we live in very polarized times, but, that can increase. Or one of the things that could happen is maybe some of the polarization decreases and we find one another again. Yeah.
I just want to add one thing there. I think that's what made America so problematic, is that we happen to have like one of the most divisive political figures when we went into this pandemic. And every time he touched something, it turned to gold or dust, depending on which party you were in. So he came out in June or July of 2020 saying, I think all the schools should be reopened in the fall. And the moment he did that, all politically right states pushed really hard to make that happen, and all politically left places didn't. So we have major metropolitan areas, Chicago, San Francisco, Washington, D.C., where children, inner city children, poor children, minority children didn't go to school for a year, almost 1 year, or in 1 year in some cases. And we have other places like Florida where they did go to school. It had nothing to do with SARS-CoV-2 spread, nothing to do with hospitalizations or ICU beds. It had to do with who touched this. That's crazy to me. That's bad policy. And the next thing he touched was that mask. He didn't like to wear it. And he said, look at that guy over there. He's wearing the biggest mask I've ever seen. I was like, oh my God. And the more he touched it, the more people who disagreed with him sanctified it, and the more people who agreed with him demonized it. And so it became this incredibly divisive thing. So now here we are. We have mask mandates for 2-year-olds and other states that have an anti-mask mandate. You're mandated not to mandate. You're not allowed to mandate if you want to mandate. And it's schizophrenic. And why? And I was like, we just needed one cluster study. We needed equipoise. And that to me is a tragedy. And I think people don't realize, and I'm on the political left, of course. I mean, well, not of course, but I'm on the political left. So I didn't like this man. But I think you can't let yourself be moved by the political figure you dislike. You have to follow the data. And I feel my colleagues didn't, and they were let themselves be swayed. Rob, I'll let you have the last word, and then we'll let you go. Thanks so much for doing this, both of you. It's been a real pleasure.
No, it's a pleasure. I mean, look, I think this point around politics and public health and science is such an important one. It's hard to overstate it. You said flippantly around following the science earlier, and you're absolutely spot on. There is no one science. The reality is we are all influenced by our own experiences, by our own kind of what we see in front of us, our own perceptions of risk, and our own politics. I mean, a lot of these things are we might try and think we're being very objective, and of course we all do, but they all influence us. And I think this is a really good one to crystallize, that the idea that, look, I can't think of anything I agree with Trump about generally. If I tried to, there probably is something. We all agree on more stuff than we think, but I can't think of anything.
I can't think of many things, but schools was one.
Yeah, but on this one, I do. It's, it's even a broken clock is correct twice a day. We have to try and acknowledge that it's not wrong because someone we don't like or disagree with thinks that it's right. And I think that's where we need to keep challenging ourselves. We need to have these debates. We need to be open, and we need to say, look, show you're working, and have some humility. And as Mark said, if people will show us a decent bit of a kind of analysis or a synthesis or even just lay out their argument in a set of tweets of why they think this is a good policy to mask preschoolers, I'll happily stand up, withdraw from the peer review our piece, and say, yeah, I'm wrong, I think, but whack the masks on them. I don't think they'll come up with that, but we have to try and be open to that point of view. And if it comes, then we change our view. And there is no one science. And we've just got to try and find our way through this pandemic by using our brains and thinking and listening to each other.
Mark, any last thoughts?
No, nothing. I think Rob said it better. And I'm just like, we've just got to find a way to listen to one another, and not use credentials to write off people, whether that's Trump or whether that's, there's been a lot of that this pandemic around, there were a number of Stanford professors who trashed people simply because they didn't have a PhD or something, or whatever. No, let's listen to the argument, look at the data, and find a way through.
For years, I've been doing cancer medicine, and whenever I comment about some cancer drug, they're like, this guy, he's not an amyloidosis expert, so he can't really. And I was like, okay, I'm not an amyloidosis. I was like, okay, I see a few different diseases. I don't just do amyloid, fine. But then now it's, it's not. It depends on the day of the week. Whatever you're not, you're not a pediatric infectious disease doctor. And then when they find one that agrees with you, well, he's not the good one. He didn't train in the right place. So I was like, oh, there's always something. Well. Thank you both. I mean, I think it's a great paper. I read it and I enjoyed it. And I think it's an important point. And it's easy to lose oneself in anxiety. It's important to remember what the core goals are, which is, I think younger people are precious, and we need to look out for them. They're not going to be able to advocate for themselves. And we have to be careful that we don't let our adult anxieties result in depriving young people of young experience that is very important to them when they are not benefiting, and it's actually not even helping us that much either. It's just treating our anxiety, and we have to be very careful about that. So thank you both, gentlemen, for pushing on this. It's a very important topic.
Thank you.
No, thank you.